2020 and 2021 have been forever marked by the COVID-19 crisis. These events have stressed the healthcare system. Many hospitals are operating at capacity, and the wait for beds can be days. At my own hospital, we've received transfers just looking for a bed from as far away as Oklahoma. Outsiders assume the strain on the system isn't due entirely to the global pandemic. We in healthcare see a different problem. We see a shortage of registered nurses. And it may get worse. McKinsey and Company report that 22% of nurses are considering leaving their current position. The data I'm sharing today comes from the 2021 National Healthcare Retention and RN Staffing Report. Last year, hospital employees turnover reached a high of 19.5%. Since 2016, the average hospital has turned over almost 91% of its workforce. At today's rate of turnover, the entire staff of the average hospital is replaced every 5 years. Focusing on just RNs, we see that the turnover rate is now almost 19%. At this rate, a hospital will replace its nursing staff every 6 years, and the average cost of turnover of a single RN is over $40,000. The average hospital is now spending $5.1 million per year just on nursing turnover. We've heard the stories of frustration and burnout. We've seen these nurses. In 2020, the top 3 reasons for their voluntary resignation had a tie at first with relocation, aka travel, and career advancement. Retirement came in third. This is the first year nurse retirement has been in the top 3, and it's expected to remain a driver of resignations beyond 2030. Daily issues for RNs such as salary, scheduling, commute, turns out those were actually in the bottom 4. Where does the current rate of RN turnover leave us? The national vacancy rate for nurses is 9.9%. Hospitals reporting the low vacancy of 5 to 7.5 dropped by greater than 50%. The greatest expansion is those at the 10 to 12.5% vacancy down here, which we can say more than doubled. We know the problem this causes: poor patient outcomes, falling patient experience, excess labor costs with overtime and travelers, fatigue, and burnout. And it's not just the nurses. Just over 27% of hospital new hires leave in the first year, and 50% of all voluntary resignation happens in the first 2 years. Terminations, 83% had less than 1 year of service, and 92% less than 2 years of service. Hospitals need to look at how they choose new employees and how they build early confidence, commitment, and engagement. The longer we keep them, the more likely they are to stay. McKinsey and Company and the advisory board are 2 healthcare consultants who have a lot to say about this topic. The first step, they say, is support your current staff. Do all you can to keep them. Nurses need to use their time in patient care, not clearing trays, not running down supplies, and not dumping trash. Help them be at the bedside. Don't just plug them into a shift and hope for 20 years of service. Put new nurses on pathways for advancement as soon as you hire them. If they're on a pathway and they can see the road ahead, they may not be willing to jump to someone else. 50% of employees say they would leave for a new job if they had more flexibility. And those who report no flexibility are 2 times more likely to be unhappy with their job. So get creative with bonus programs. Make sure employees always leave work at work. Disconnect from email. Consider meal planning for after shifts or running errands. Introduce new scheduling protocols. Let nurses shadow other areas in your hospital. Maybe they won't leave you, they'll just shift to a new job or a new unit. Most hospitals follow the traditional care model with a shift nurse assigned to patient load. Depending on the unit, experienced nurses may excel in this environment, but also may have little time to support or supervise new graduates. Novice nurses may feel understaffed, overwhelmed, and ill-supported. One strategy is to embrace the mix of RN skill level. If you have a unit with lots of new graduates, consider having an expert nurse lead 2 teams, staffed with novice RNs, a CNA, and a patient care tech. Turnover for CNAs and patient care techs in 2020 was 28%. when we don't have enough of, we all know the consequences. The duties of these individuals fall to the nurses. This is among the items contributing to nursing job dissatisfaction. So keep two things in mind. You have to keep a competitive wage to hire these staff members. Just look at the competition. It's not always other hospitals. It's Starbucks and Target and Costco. And like nurses, CNAs and patient care techs are often looking for advancement. They may be your future RNs or cardiologists. Show them the pathways early and keep them on it. It will improve their engagement and longevity. Nurses with long tenure may be resentful of reported lucrative contracts, extended agency nurses. Your loyal nurses need to know the situation hospitals are in today. They also need to know how long agency nurses will stay and how the added staffing benefits everyone. If your nurse leaves for any reason, keep the door open for a return to work. Work to turn travelers into full-time hires. This one works for us often. Another strategy is to sign travelers to long-term contracts, maybe 12 months. It introduces stability and provides better value than having 3 or 4 traveling nurses revolve over the same period. Do your best to coordinate downstream care and distribution of patients. You don't want patients trapped in the ER, so you have to clear the floor as soon as patients are ready to leave, not wait for placement. Typically, the easiest disposition is to home. Otherwise, try to send patients to the lowest acuity post-acute care site as possible. We know there's long-term acute care, inpatient rehab, skilled nursing, SNF at home, home health care aides, and outpatient rehab, among other models that are just being innovated. As you move down the list, the discharge becomes easier and the length of stay shortens. Discharging patients in a timely fashion creates capacity on the floor, capacity in the ER, and may just relieve a little stress on your nurses. Thank you for your time and interest today, and I'll leave you with 2 questions. Number 1, have you seen any innovative nurse recruitment and retention strategies that you can share? And number 2, do you think the Nurse Compact, state licensure, and staffing agencies have been helpful or harmful to the current nursing situation? Thank you.